Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. Hello, doctor. Welcome back to Guatemala.
Thank you, Luis. Thank you so much. It's a pleasure to be back.
How was your trip in Canada?
It was lovely. It was nice seeing my family and patients that I have up there. And the weather was quite white and snowy, but always welcoming because I love the snow. It brings out the child in me. So it was fun.
Great. This is good to have you back. Doctor, we have a very interesting topic today, right? We're going to talk about strokes and how stem cells can help to prevent a stroke and actually if you had a stroke. Is that correct?
Yes. We use stem cells for stroke and cerebral and neurodegenerative conditions all the time. And we have basically what we do with the stem cells is we deploy them so that they get past the blood-brain barrier and into the brain with an IV of mannitol as well as intranasal aspiration, like a nose spray of stem cells that bypasses the blood-brain barrier. And in some cases, also intrathecal stem cells, which means that we put them directly into the cerebrospinal fluid in order for them to get to the brain and the brain stem very effectively and directly.
So we can say that stem cells can actually help to prevent a stroke?
It can help. They can help to prevent strokes and specifically post-stroke to undo the damage that's been done. So all of the regeneration of neuronal cells in the brain, basically any symptoms of a stroke can be undone. And with enough stem cells and the right numbers and the right types of stem cells. So we're finding of late that endometrial stem cells, which are one of the mesenchymal stem cells that we use at the Stem Cell Healing Institute. We're finding that neurodegenerative conditions and stroke and TIAs and neuronal detrimented conditions respond very well to endometrial stem cells. And so we tend to use those more often than not for a stroke condition.
But this treatment it involves more than just applying the stem cells. What will be the normal treatment for a stroke patient that suffers stroke?
Yes, you're right, Louise. We have a very comprehensive approach to doing a stem cell treatment. And for stroke, what we tend to do is we'll start with a pre-treatment protocol that involves with certain key supplements and some key dietary changes that help with the condition in general and preparing the body for receiving the stem cells. So we start with that. We start with other supplements that involve we call our proprietary blend a stem cell enhancement formula that has key minerals and herbal extracts. We also do oxygen therapy. We begin with oxygen therapy. It can be in the form of hyperbaric oxygen or exercise with oxygen therapy, depending on the limitations of the patient. And we also do, which is very important, is a detox. We call it our total detox program that involves a nutritional IV of high potency antioxidants and detoxifying agents, vitamins, minerals, and we follow that up with a suppository and B shots. And then the final thing that we do in our comprehensive approach is this is age dependent, but we do growth hormone therapy. And again, all of this not only prepares the body to receive the stem cells, but allows the stem cells to work better. So we begin with all of these, and we follow it up after treatment also for up to 3 months. So it makes the treatment, the results much more effective when we make this comprehensive approach. And there's something else that I have to mention, Louise, is that we also ensure that the patient is in the right frame of mind. It's so important, the psychology and the emotional aspect of healing, and so that is something that we address at the Stem Cell Healing Institute. That is so important for complete healing and for complete well-being. So that is something that we don't neglect either.
Yeah, and this treatment is so complete because it involves also the pressure and hypertension, I suppose, and can also involve the
Hyper.
heart disease, and stem cells can help to,
Yes.
yeah.
Yes, yes, yes. So yes, that's a very good point, Louise, and that is that when we apply the stem cells into the blood, the stem cells go everywhere that the blood flows. So yes, you made a really good point that not only do the stem cells get into the brain where the damage is, but anywhere else there is damage, there are cytokines that are released for that specific tissue, that signals to the stem cells that, hey guys, there's damage here. And so anywhere the blood flows, the stem cells will get to those organs and tissues and actually have a really great overall healing effect by putting the stem cells into the bloodstream. So yes, it can help hypertension all in the same shot, can help cardiovascular disease, liver disease, kidney disease, impotence in many cases. Yes, so we get a very great overall benefit from it.
So we can actually say that a patient will start feeling better once it starts our treatments.
Yes, yes, we have had most patients report immediate energy levels increasing. We have patients reporting clearer eyes and vision, and a clearer mind and more focus and concentration, sleeping better. Um, a lot of stroke symptoms diminish over some time. Um, where depending on the degree of the stroke and the damage, we see it takes time for regeneration and for the cells to actually regenerate. So that can take anywhere from a few weeks up to a few months to see regeneration. But we've seen reversal of symptoms, and it's been quite incredible, along with the oxygen and growth hormone therapy and the detoxification.
How long will the treatment last here in Guatemala if in case the patient comes from different countries? So how long would they expect to stay in Guatemala?
Yes. So depending on what we're treating, so a stroke, in terms of a stroke treatment, we would need the patient to stay 7 to 10 days, usually 10 days for a stroke patient. And that allows us time to start the pre-treatment, which usually begins at home, but we do the IVs and the oxygen therapy as well as the total detox and so on. So we start that, and then around midway we'll do the treatment, and then continue with everything. And they go home with a lot of the supplements and growth hormone, and if they can continue um, hyperbaric oxygen at home, then we'll have them continue that at home also. So up to 3 months of everything.
Okay, and after the patient leaves, can we do some remote treatments so for the stem cells to keep on working?
That's a very good question, Louise. What we do is we do follow-ups. We do telephone follow-ups. Um, at first, it's bi-weekly, and then monthly, and then every 3 months and 6 months. And what we do is we do provide a 6 month booster treatment if the patient is willing to come back to Guatemala. We do provide a booster treatment of platelet lysate, and that would be after 6 months. And hopefully our goal is to not have patients have to come back for another treatment. Um, a lot of clinics do depend on perhaps patients coming back for other more treatments, but we are in the game where we provide enough stem cells, the numbers as well as the viability for a patient not to have to come back, and that is our goal. So yes, and we do our follow-ups and always provide support remotely. So we're always available to provide support and follow-ups for our patients.
I think it is important that I ask you again because, well, we do mention it in every podcast, but it's important for the patients to know where do we get these stem cells from.
Yes. So in the case of stroke, because it is a cerebral neuronal degeneration, we like to use endometrial stem cells, and that's from a healthy donor, a female donor from the uterus of a healthy female donor, and that would be our first choice. However, we are aware that patients are not comfortable with donors and would rather use their own autologous stem cells, and that is we would opt for the bone marrow stem cells, and we have great numbers in the bone marrow as well as in the endometrial stem cells. And we can also use adipose derived stem cells from the patient also. And so those, and we use umbilical also. We tend to use more autologous or endometrial because endometrial has been, again, the studies have found that neurodegenerative conditions as well as autoimmune conditions like multiple sclerosis, diabetes, rheumatoid arthritis, lupus, they all respond really, really well to endometrial adult mesenchymal stem cells. So, yes, there you have it, Louise.
Doctor, is there, if there was a case that the patient can bring their own donors, can you accept like relatives or friends, or if they, in case
That is,
they want to bring their own donors?
yes, I've never been asked that before, Louise, and I think that that is a very, very good question. Absolutely. If once we do the screening of the donor and we have quote unquote a clean at the right age and everything checks out with all the screening, we are happy to use a donor of their choice. And the only thing we would need is to have enough time to process and harvest as well as isolate and expand or grow the stem cells. So we would just need time for that. But other than those limitations, it would be absolutely possible for a patient to bring their own donor.
For the listeners, just in case, we can arrange all the travel arrangement as far as book the flights, and also we do have like an apartment here, right, doctor, where they can stay.
Yes, we absolutely. We provide accommodations as well as a driver, a chauffeur for all of the transfers and appointments, and uh, and we will also help with organizing flights and things like that. And so we try to take care of everything for the patient.
And you may also have time to travel around Guatemala, which is a beautiful
Yes,
country to visit.
absolutely.
Yeah.
Yes, that's right. That's another thing. It's Guatemala is a destination spot, so we help arrange tours and coffee farms and uh, volcano tours and Mayan ruins, and it's quite spectacular.
So you even have time to do some sightseeing. Doctor,
That's right.
how can the patients reach you?
They can reach us by email at info@stemcellhealinginstitute.com. And they can also go to our website and fill out the contact form. The website, the shorter version of the website is www.stemxcure.com, and that links into our www.stemcellhealinginstitute.com. And we have our podcasts on YouTube. We have our Facebook page as well as Instagram. And they can also reach us by phone and WhatsApp at plus 502 4220 7297. That's plus 502 4220 7297, as well as our US number 209 690 7836. 209 690 7836.
Thank you, doctor. Is there anything else you would like to add to this podcast?
I don't think so. I think you've asked such wonderful questions and it's been quite comprehensive.
All right, doctor. So you have a great day, and once again, welcome to Guatemala.
Thank you so much, Luis. You have a lovely evening.